I was born in San Antonio and then moved to Sacramento, to Dallas, North Dakota, Northern Virginia, Louisiana, Atlanta, and then I did my undergrad in Indiana, med school in Cleveland, and now here. So my 7 years in Philadelphia are the longest I've ever lived in one place.
Your father is a pilot.
Indeed, yep. He flew B-52s for 20 odd years.
Wow. So B-52 bomber pilot, and somehow everybody in the family goes into Air Force, Space Force,
Mhm.
but you, like, what particularly about you did they recognize you had to be a doctor?
I was always a bit bookish, to put it a little less kindly. I was always a nerd.
All right, this is Dr. Lee. I'm here with Dr. Connor Wathen, who is about to graduate. He's still, what, another 2 weeks here?
Two whole
Another 2 weeks here at Pennsylvania Hospital. And he's got to be one of our most honest, hardworking, and just the prototypical resident, what you want in a resident, somebody who's going to take care, and what you want in a doctor, somebody who's going to take care of patients, be honest, and provide the best care possible. And you would think that that's like expected out of all, but not everybody can match that reality. So let me introduce you to Dr. Wathen. Why don't you tell us a little bit about where you started?
All right. So, like Dr. Lee said, I'm a seventh year resident here at Penn. Um, had a bit of a long path to medicine. Didn't exactly see myself coming here. Grew up in a military family. I'm the youngest of three. Moved all over the country. All of my siblings went into the Air Force and Space Force, actually. And I tried to ignore my parents when they told me I was going to be a doctor. And lo and behold, they were right. One semester into college, and I was the first student my advisor had seen in a long time switching into pre-med. So I did a liberal arts degree and a pre-med degree at the University of Notre Dame before finding my way to Cleveland Clinic for med school. The advice I got at the time was find the most affordable school you can go to. I got a full ride, and I didn't look back, and it was the best decision I ever made.
Wait, we got to go back here because this is a little bit crazy. Wait, so your father is a pilot?
Indeed, yep. He flew B-52s for 20 odd years.
Wow. So B-52 bomber pilot, and somehow everybody in the family goes into Air Force, Space Force,
Mhm.
but you, like, what particularly about you did they recognize that you had to be a doctor?
I was always a bit bookish, to put it a little less kindly. I was always a nerd, um, which I think an aptitude for both science and engineering, and yeah, to a degree, some maybe more social skills than your average bookworm would have. Because I do think that is a huge kind of key part of where I've found success in medicine is being able to relate to patients, other team members, providers, things like that. But yeah, I think some combination of those that maybe I didn't necessarily see in myself. My parents knew me best and set me on my path.
That's very interesting. So does that mean your siblings are not nerds?
They are not.
How about people skills?
Very, very personable.
They are
Yeah,
personal.
absolutely. Absolutely.
Uh-huh. And you would consider yourself less personal than them?
Hmm.
Maybe they're more outgoing
Much more
and
outgoing.
ebullient.
Absolutely. I've always been a bit of a introverted, quiet, soft-spoken type.
I see. Interesting. But I think that's very. How many siblings?
I'm the youngest of three.
Okay, so three kids, and they saw the youngest one. Maybe they were just being selfish, and they just said, we're getting older. We need one child to be a doctor.
Someone not in the military.
Yes, exactly.
My mom's last hope.
Well, very cool. So you're at Notre Dame. It's a wonderful Catholic university, and we'll have an aside later about our Pope, but the first American Pope. But then Cleveland Clinic, and you actually ended up working with one of my former
Mhm.
colleagues, Andre Machado.
Yeah. I give him almost not all the credit, but the vast majority of the credit for why I'm here today. I
Wow.
did not start medical school thinking I wanted to do neurosurgery.
Mm.
I started out, I did radiology research during my time at Notre Dame and thought, hey, if I could find a way to do that, that would be my goal. And I had to select a lab to work in. So I had to select an area of interest to work in before I started my first year of medical school. And I figured, where would I have the most probability of working in an imaging focused lab? And I said, neurosciences. We get scams all the time, right? Instead, I was not thrown into an imaging lab. I was thrown into a lab run by Dr. Machado, and the rest is kind of history from there after he took me under his wing.
Wow. Yeah. So Andre is a real great person. I had a great time working with him. It was only 6 months that I spent time with him,
Mhm.
but had a lot of respect for him. And he became the head of neurosciences at the
Mhm.
Cleveland Clinic.
Yeah, the neurological institutes in charge of neurosurgery, neurology, psychiatry, physical medicine, rehabilitation. I think he really taught me is kind of how to do it all. He's a phenomenal researcher, phenomenal surgeon, but also has a great way with both his patients. But I think, as evidenced by his leadership role, very very excellent leader, and really knows his people well, and knows his mentees well as well. Which is how I feel like I wound up here.
That's a real credit also, I think, to the Cleveland Clinic because he's an immigrant. He did not do his studies in the United States. He was in
Yeah.
Brazil, and now he's leader of the Neuroscience Institute at Cleveland Clinic. So, and I think that's really remarkable. But this is about you. So after that, then
Yeah.
you came to Penn,
Yep.
and
Came to Penn, and it's the reasons for coming here were many. I loved my time in Cleveland. I met my wife in Cleveland. My wife happens to be a pediatrician, and so from Central Pennsylvania, had a lot of ties to the area. So I did a rotation here as a medical student. I did a sub internship to get to know the program, get to know the people better, and very quickly, found that this was a place where I really gelled with the other residents, faculty, and it was a place where I could see myself winding up for 7 years, which is not an insignificant period of time.
so a lot of us start, we're very idealistic. We have all kinds of great visions and dreams of the science we're going to do, the surgery we're going to do. And then you gradually shifted away from, well, not necessarily away, but you did research and then you are now picking a clinical field.
Yeah, so under Dr. Machado's mentorship, I was very interested in functional neurosurgery, things like deep brain stimulation and movement disorders. The research I did with him was DBS as a stroke rehabilitation therapy, and understanding the brain and how we can manipulate it to recover patients rather than progressively, watch them kind of fade away with, malignant gliomas and things like that. That was what really got me excited. However, upon getting to Penn, I found a new set of mentors and found some fantastic mentors in the world of spine surgery. And one, had great mentors, and then two, found I just loved the technical challenge that the field poses. And while I did my best to explore all my options and kind of work with a broad swath of attendings, that was kind of what I found myself gravitating back towards time and time again.
I think in some respects, I consider spine to be a field that requires the most amount of moral fortitude because if you let your judgment slip, you can end up down a slippery slope of yeah, challenging procedures and outcomes. I think that
Yeah.
you're in a good position to maintain that appropriate patient focus with your outcomes, and I'm excited for patients and for our field because of
Yeah.
people like you going into that.
At the end of the day, the question you have to ask yourself is there something I can do to make the patient better? Not to do a surgery, what can I do to help this patient? You got to be honest with yourself about how likely am I to help them with any given intervention I offer or perform. And it can obviously get very tricky. Patients are debilitated with back pain. It doesn't always mean surgery is the answer. And kind of that's where having fantastic mentors here who really show you how skillfully you can tease that out. Who is really going to benefit, who is not, and then also teach the more complex skills for the more clear cut indications where surgery is a necessity,
Yeah.
without a doubt.
Yeah, I think just for our audience or med students who may be listening to this, there's clear-cut indications such as trauma, you broke your back, or tumor, where you have to remove the tumor and reconstruct it. But then there are less clear indications when someone's suffering in pain. Now, we can always justify it that we're going to help them with relieve the pain, but do we really know whether our procedure is going to help? And that's where it gets a little bit complicated.
Yeah, absolutely. And that's where, being, proactive in terms of, being diligent about collecting data on your patients, being honest about your outcomes, tracking those outcomes, whether it's part of an individual effort or part of larger registries, randomized controlled trials to try and better delineate, who are we really going to help. We spend so much money on spine surgery, we can't do that forever.
Yeah.
We got to make sure that we're picking the right patients and doing the right surgeries for them at the right time.
Yeah. So I want to transition a little bit away from spine, but just back to your upbringing, actually. You were telling me that you moved around a lot.
Yeah.
And
I was born in San Antonio and then moved to Sacramento, to Dallas, North Dakota, Northern Virginia, Louisiana, Atlanta, and then I did my undergrad in Indiana, med school in Cleveland, and now here. So my 7 years in Philadelphia are the longest I've ever lived in one place.
that's really remarkable. But they always say that children who move around a lot become very resilient. And I just want to kind of delve into that a little bit and how that may have played some role in your training too.
Yeah, absolutely. You learn a certain amount of self-reliance. You find yourself in a new situation, a new group of people on a daily basis, on a yearly basis. Changing hospitals pales in comparison to uprooting. Moving to halfway across the country. And the skill set you learn, though, learning how to interact with others, how to befriend others, how to quickly understand the dynamics in play with a new group of people and a new institution, things like that, all go a long way. Not to mention, it just teaches you that you can do it on your own if you have to, which kind of gives you the confidence to kind of keep moving forward even when things are challenging.
Yeah. And I guess, not everybody will have that experience or that capability to rely on themselves or resilience. And I guess maybe some advice you might have to some students who are just starting or starting residency.
Yeah, I would one of I think the most important things that I realized, and when you choose a career like neurosurgery, it is not something that you go into for the work-life balance. There is no doubt about that. As long hours, it is taxing, it is emotionally draining. You see sick and disabled patients. It takes a toll, and you have to have a deeper appreciation and a kind of willingness to make sacrifices for it. And you have to really be honest with yourself. Am I willing to give up my time in my late 20s, early 30s to dedicate to this? And I think, once you acknowledge, though, that this is more than just a job, you don't just clock in, clock out, and forget about the patients. It becomes a lot easier. These patients are entrusting you with, some of their most vulnerable, difficult periods in their lives, and they're putting a lot of trust in you. And that is a huge responsibility, but it's also, it's it's a gift as well, in a sense. And the trust that they place in you, it's not something to be taken lightly. And I think once you're able to kind of acknowledge and truly kind of start wrapping your head around that, it makes it a lot easier to say, yeah, of course I'm going to do everything I can to be the best I can be so I can take care of this patient in the next one.
Yeah. So, you face a lot of challenges during residency. So, for example, one of your co-residents unfortunately had to take time off, and then all of a sudden you're on call quite a bit, and the struggles are real. And how do you prepare yourself for that, or how do you?
So you just you have to take things as they come, and as we kind of pointed out, I've spent my life moving around. The only constant thing is change. You can't quite predict what is going to happen next. Although all I know is that it's going to be a bit different, and I'm going to have to be, kind of nimble and be ready to kind of tackle the next unexpected challenge. And again, you keep the focus on what's important, on your patients, your co-residents, and kind of doing the best thing for your patients. My chiefs, when I was a PGY2, had a motto that they would put out, my patients, my team, myself. And if you're keeping those priorities in line, you take care of your patients first, you take care of your teammates, and then you can't neglect yourself, but you do have to take care of yourself. It's a lot easier to take care of yourself though when you have a whole team of other people also pulling in the same direction and looking after you as well. And that's where I'd say it's a team mentality. You can't do it on your own.
Yeah.
So, well, there's a lot of resilience and self-reliance. None of us are working in isolation. We gotta kind of keep that in mind.
So I'm just gonna reiterate that again because that I've never actually heard that before. My patients, my team, and myself. Interesting. So right, you focus on your patients, then you focus on your helping your
Mhm.
colleagues who are helping to take care of the patients, and then you have to think about self-care. So interesting, because that reminds me of a phrase that I picked up in college, which was "for God, for country, and for Yale." Which is a little bit different. Like God, maybe the patients, and maybe country. I don't know.
Same,
Doesn't really fit.
same ideals.
I'm sure everybody has some motto that fits. So you're now you're about to graduate 2 years, and what are your future plans?
So next year, next month, I'm going to be going to do a complex spine fellowship at Brown University with Dr. Ziego Coslin, as well as some of our former residents from Penn, Patty Sullivan. Really looking forward to that. And the talks for a job afterwards, and we'll see where that leads, potentially back to Philadelphia.
Yeah, so we are obviously excited potentially to have you back here, but you have to explore all different opportunities. Where do you see yourself in 5 years? Academics, research, clinical practice?
Yeah, for me, what I have really found that I love the most is the clinical aspect of patient care, and I love the challenging cases though that being in an academic environment presents. And again, those more clear-cut indications, difficult tumors, major traumas, things like that I enjoy. And alongside that, the other thing that I found is one of the most rewarding parts of my time as a resident is training the junior residents.
Mm.
And so, staying in a place, like Penn, where you have, phenomenal residents coming into this program every year, an opportunity to continue to kind of train and shape them into neurosurgeons is something that I'm very much looking forward to in the coming years.
Great. Well, it's been a real pleasure having you. I mean, you've always been somebody who just gets the work done and doesn't complain and provides the highest quality care. So we're gonna miss you, but we're hoping you come back. So
Knock on wood.
all right, very good.
Thank you, Dr. Lee.
Yeah.
It's been real.